So good morning. So this is the second Italian on the stage. He's from Veneto region, but my father and my mother are from Veneto region and from Torino, actually. But there is some commonalities there. I have the responsibility to cover, as for Microsoft, all the East European region for healthcare. And I'm part of a team which is based in Europe, but also is pretty much connected, an extension of the American team that is focused on healthcare. Healthcare is one of the industries that we focus very clearly because we see an incredible value for the technology in the change, in managing the change. When we talk about Microsoft, and I will bring the full picture to you very quickly in 15 minutes, but then I will focus on the business intelligence. But I want to give you all the background for that, because if you don't have the background, you will miss a fundamental point. And the fundamental point starts with Microsoft engineering, so the product that developed, the people that develop the product. And in below of this chart, you see a city. This is the city of Microsoft in Redmond with 50,000 people that develop software. These are not developing projects. These are developing basic products, which are then used by our partners, our customers, to build a project like the one that you have seen before. All these people, 50,000, it's $11 billion research and development investment, are creating products that have one important element. They are all together. They are designed from the product perspective to bring everything together. What does mean everything together? How many of you are using Excel today? That's good. Now, what is the power of Excel? Is the capability of calculation? Yes, it is. Are the functionalities? Yes, I am 20 years in Microsoft, and probably every day I learn new functionalities. But the reality, the power of that is the integration with the rest of the other products, PowerPoint and other products which are that. And whenever you do a drag and drop, you are exploiting this power of integration. Two different products that combined are working together to provide personal productivity. Extend this concept of personal productivity, which the business intelligence, the analytics is part of it, not only to the people, but to the organization, to the groups, to the nations, okay, and to the globe. Okay? In order to make this change, you need to implement products which are absolutely standard products, are using the standard which are coming from the market and are very high quality. As a matter of fact, out of 50,000 people that are developing, half of them are doing testing, okay? That's very important. Bring this personal productivity to a more team productivity between organizations, okay? And I want to touch this part, and the business intelligence is part of it. I think this is the way to move. I think so. How it works? Can anyone help me on doing this? There is one button to strike, and I don't think I'm making a mistake. Yeah, this one. Okay. So now, what is happening? Yes, what is happening in the industry? And that's very important to realize also for the analytics part. The hospital, per se, are changing dramatically their, let's say, scope. They are the point of care most important, and actually today they are a bottleneck, right? So what we have seen more and more is that the people need to have care before going to the hospital, in the hospital, and outside the hospital. Treating them as a community and treating them as a patient in multiple points of care. So hospital is important, but the capability to manage healthcare to people before getting to the hospital, in the hospital, and outside is clearly a fact. And this is actually creating a fork where we see a huge, let's say, opportunity for the healthcare system to evolve, to create let's say, a combination that mixes the digital life of people, and you see more and more our kids go in that direction with these mobile devices, and be part of a virtual team. So to bring these capabilities outside the normal boundaries. Technology is designed to support this kind of change. Okay, that's key. Okay, and this means that we need to focalize in three major areas. Okay, and this is actually happening with the European Community investment, and it's happening in all the countries and so on. The first element is that you really need to develop a digital connected system. Okay. It's obvious that more speed you have, better it is, but we need to make all the system connected together, including the people, and digitize all the paper that is actually flowing around. Okay, so that's extremely important, and this is the basic. Okay, so become a digital environment. Then at the same time, we need to provide tools and technology that are more and more personal, more close to people, and I will explain later what is. In order to combine all of this, and this will bring the attention to the analytics, to provide an healthcare which is more predictive. Now, be more predictive is that I have an action and I'm expecting a result. And I have all the data in order to make an action and to, let's say, be predictable and prevent this part. This means that you need to have access to data, not only the historical data, and then you create a chart, but also to data which are telling you where the system is going to prevent any possible problem. Okay? So it's not looking back, but it's looking forward. Okay? That's extremely important. And this is actually, impacting the technology. And it's creating a new scenarios, okay, where, the digital systems are really, taking note. And you see here all the applications. So, for example, solution that span outside the hospital, okay, and they go mobile, for example, okay. So mobile productivity and the point of care even outside. Or provide solutions that, in order to become more predictive, are they actually providing, operational efficiencies. Operational efficiencies in the clinic environment, but also operational efficiencies from a financial point of view, because one of the areas that we really need is to increase the capability for care, but at the same time, being able to use the resources that we have, even in a very tough moment like this one, where actually the resources are declining. So do more with less resources. And this creates, the new ecosystem that is extremely important to realize. I hope it works. Yes, with the people and so on. And the reality is the fact that technology today is helping on doing this. Technology now is more closer to the people. You see, how many of you are using mobile phones. There is clearly a capability to create a collaborative environment between people, okay, and between organizations, and that's I will touch base on this part, and use the new technologies for analytics combined with the power of the cloud. And the power of the cloud enable an incredible capability of processing power and data storage power on the base on how you use it, okay? So per use, not by buying assets, okay? And this is actually driving a new cost model for the industry. Okay, very important to realize this part. Let me go now very quickly on the solution. I hope it works. Yes, the first one is collaborative environment. Care is actually now providing several points of care to our citizens, to our patients, across a multitude, not only in the hospital, but before and after and so on. It's obvious that you need to have technologies which are enabling this collaborative environment. This is technology that span the, I would say, the mobile environment, the areas of, for example, more consumer environment, but which is connected to the overall system and create the way how the people are communicating between each other, are sharing information, are taking action of that in one single integrated environment. Okay, that's very important. Doesn't matter if you are in your desk, doesn't matter if you are on the move. All these technologies are enabling this kind of collaboration. The benefit of collaboration are incredible. You are reducing the waiting line. You are decreasing the cost, because by having all the people working together, you are more effective and efficient, and therefore you are reducing the cost. And this technology which are available to the market, I'm talking about Skype and Skype for Business, are bringing all of these all together, and are, guess what? They are based on Office system for what concerns Microsoft. Okay? That's very important. We have at the moment, as part of this collaborative environment, important projects all across the region for telemedicine, telehealth, okay, which is actually happening all over the place, and it's really a sweet spot, I would say, in the industry at the moment. I hope it moves. Yes. And this brings the collaboration up to very sophisticated collaboration with information which are using the telecom media to share information which are even very, very deep and precise, to bring all these people, physicians, specialists, all together to really compress the time to health, to bring the solution more close to our patient, instead of having multiple steps that needs to be synchronized. Technology is part of these, scheduling capabilities, communication capabilities, sharing of information, real-time communication are key. Mobility, because whenever you have an application, this needs to go mobile, because the people are on the move. Doctors, typically, they have 2 or 3 mobile phones with them, okay? And it's very important to bring this kind of capabilities on mobile. The nurses, okay, more mobile you have, less paper you have. Less paper you have, less problem, issues you can create. And especially, for example, in retreatment. In Italy, for example, I was reading a report, 5.7% of the spending for the healthcare is because of people that are going back to the hospital in order to be retreated, because they get, for example, an infection, right? 5.7%, which is translating in money is $2 billion. So more digitized and more collaborative, and then you get this kind of results. Mobile across multiple domains. This is, for example, in cardiology done by a partner in US, which is called iStrip. Okay, let's now start to dig inside the analytics part. We have a huge opportunity, which is coming today from technologies which are cloud-based technologies. Okay, we can discuss a long time about how to use the cloud in healthcare and so on, but it's a different aspect. The key element that I want to raise is that today we have the power of multiple thousands and thousands of computers, processing power, data power, in order to manage a large quantities of data, and be able not only to make a report to understand where we are going today, but also to have look-forward capabilities to understand where we are going and actually prevent, Okay, and that's the area where I think it's really the next extreme for that. Okay, so multiple data coming from multiple sources, and then you need to have an architecture to address that. Very clearly defined. You have seen in all the presentations from the Minister of Health this kind of architecture. This needs to be very well defined and needs to cover all the areas which are pertinent. One area which I want to mention, across all of these, you don't need only to manage records, so basically digital data which are structured, but also information which are unstructured, information which are coming from images, information which are coming from documents. So the system that you need to have needs to be able, using new technologies, to really bring valuable information which are coming from disparate systems, including non-structured data. Okay? That's very important, because if you don't do that, then you are missing one fundamental advantage of using latest technology. And then this translates in information, which, for example, are KPI, okay, which basically help you to manage in a better way your operations, okay, the hospital, the branch in the hospital, or even your total healthcare system. But also by looking forward, managing, and so on, you can really, and having the power of this kind of processing, you can really have a view about all your geographies and how things are happening in real time. Okay? And we have focused with many tools in order to present this information in a valuable format, which is understood by non-IT people, okay? Which is extremely important to bring to. I want to show you a case, and I am approaching the end, where all this information which are grabbed then are organized by a cockpit, right? A view. Now this is an interesting technology that we developed in the last 15 years, which is a dynamic user interface where basically you bring information to specific people. Can be a doctor, can be a nurse, can be the Minister of Health, where you have in one single point organized all the information, which are including graphics, but also are including information like your mailing system and so on. And this is extremely important. It's called digital dashboard, which then is implemented in our products. Okay, so you have multiple products which are really preparing this kind of, we call it role-based user interface. One of them is CRM, for example, which in this case is patient record relationship management. But it's all based in this technology where you have a single view about the patient with all the information about that. And you can, and this technology is immediately available, okay, and you can deploy, I would say, in a very fast way. For example, this technology was used recently by one of our partners, that you can see hopefully here, to manage the Ebola issue that we had. Everything was traced. This project was done in a very limited time. The technology was really close to the issues, okay, to provide data and information to make decisions right in that moment, understanding where the issues are, geography, and all the connection between the people which are infected with all the communities where they are, okay? Because technology is important, but the time to market, the time to health is as much as important as that, okay? So technology that delivers, but technology also that is immediately available. Another example, and this is probably the last slide, is connected to an hospital in US where they are managing, private hospital, 250,000 people, typically elder people. All these people have a lot of information which are coming from devices, which are coming from pressure meter and all this kind of medical device, are all connected and presented through a cockpit the digital dashboard that I showed, which is patient-related, to nurses, which are in a center, which are monitoring in real time all the patients which are connected, 250,000, connected to the network. All this information goes to the cloud, and there is a technology in the cloud which is called machine learning, which is an expert system. We used to call it 20 years ago, expert system, which is giving already information about possible issues to the nurses. And the nurses has a real-time visibility of what's happening and has all the resources, the specialist, the doctor in line in order to collaborate. So you see, capability to grab information, display information, take action, and bring all the resources together in a very short time. One area that we are very focused, and I saw the last presentation, I'm glad for that, is coming from the fraud analytics. Okay, so this is a real example that is coming from one of the countries in my region, okay, where we are a cloud-based solution with analytics to identify, possible structures, hospitals in this case, which are diverging from the average. And again, just this project, which was 1 month work, was at a return of 2 million euro, just to understand the behavior of to the hospitals on the use of prescriptions, okay, and use of DRG in particular, how to erogate the service, okay. Now we are extending this, and and we have this kind of architecture already in place in 15 countries in US. Okay, so we have a lot of experience in this part, and it provides immediate benefit to our healthcare system. I want to, to recap, saying that, all the points that I mentioned, care, which is a continuum of care, okay, for the people which are not only in the hospital, but are in our network. We call it, let's say, a digital nervous system, where everything is connected, providing data, and the business intelligence, the analytics are important in order to be effective and drive change. I want to share with you a video which is focalized on innovation, which I hope we can see. Yes. Nothing related to business intelligence, but is specific for healthcare. Focus on something which is virtual reality, 3D model. A body of a human being is a 3D model, and how this can help, for example, our student in medicine.
We've been teaching human anatomy the same way for 100 years. Students get a cadaver, then they look at medical illustrations, and it's completely two-dimensional, and the human body isn't.
Microsoft HoloLens is a holographic computer that you wear. It enables you to bring your digital world into your real world.
At Case Western Reserve University, we are focused on solving problems and creating new knowledge.
My job is to teach, and I really think this could impact almost everything that we teach people. With HoloLens, you can see the muscles on top of the skeleton all at the same time. You can bring them in and out and exactly understand where things sit.
You can take any anatomical part and show any of it. You can move it around, you can make it kind of translucent so you can see through the outside, and that really helped me understand how cardiac anatomy worked. I actually had a moment where I found the aortic valve, and it was the first time that I'd actually seen the aortic valve in relation to all the other anatomical structures. It was a way of seeing it that you couldn't do with an actual heart.
I think this will improve students' confidence in learning anatomy dramatically.
By creating simulations with the HoloLens that lets them have an experience where they can fail, that would be the best way to learn, because we don't allow people to fail too much in real-life medicine.
With HoloLens, you could imagine having a class standing around a model, almost like a tour group in a museum, where they're all interacting completely naturally. I spend a huge amount of time to make sure they become the best professionals because it's all of our jobs to make the world a better place.
Working with Case Western Reserve University to create this paradigm shift so that we can leap together with students into the future of education. We believe that HoloLens is going to enable us to do that.
We talked about being able to use it to teach art history. We have an anthropology department too that I think will enjoy this technology.
Anytime you change the way that you see things, it changes the way that you understand them. As soon as you can change somebody's understanding, then they can change the way they see the world.
So this is an example of implementation. It's very interesting to see. What you have seen are digital model of a body. And now we have this technology, which is called HoloLens, which is in the hands of our partners and research universities. You can expect now the collaborative environment with all this information, coming up and so on, and create a collaborative environment where you don't share just information. You are sharing really live data in a collaborative environment and making decisions very fast. This is what we mean healthcare today. Thank you.